The basic requirements to look good in your skin are the two major treatments. So if somebody wants to look good and fresh, your skin will be plump, hydrated and radiant. Actor or actresses on the social media, people would always comment that they have gotten fillers done or they have gotten some plastic surgery done.
We have heard about procedures like non-surgical rhinoplasty because many people prefer not to undergo surgical procedures.
And now if we try to treat it, then you have to get through a lot of treatments and a lot of sessions of injectables. So at times it becomes difficult for the patient. Remember, the goal of aesthetic medicine is to be safe in your skin. You should always consult a qualified practitioner.
Hello and very warm welcome to our new podcast. I am your host Rahil and I am joined by brilliant Dr. Ikra.
We are absolutely thrilled to have a very special guest with us today. She is a renowned dermatologist. Please welcome the amazing specialist dermatologist, Dr. Sakina.
Thank you so much, Ikra and Sir Rahil. I must say your new hair are looking fabulous, Rahil.
Thank you. Dr. Skinner, we live in a fast-paced cities where looking your best is your lifestyle. People are often looking for quick, effective treatments with minimal downtime. So where should someone start if they want to look journal refresh?
Okay, Rahil, a very good question to start with, and I always ask my patients, even the general public, that you should look good in your skin. So the basic requirements to look good in your skin are the two major treatments which I normally offer to my patients are hydrofacial and skin boosters, because these are those treatments which make your skin very well hydrated. So what does hydrofacial do? Hydrofacial will cleanse your skin, it will remove all the dirt, and it will give you a good quality skin. And on top of that, skin boosters, these are basically injectable hyaluronic acid. So it gives hydration in your skin, and it contain the water content inside your skin, so your skin will be plump, hydrated and radiant. So if somebody wants to look good and fresh with very minimal downtime, and they want to have very fast results, so one of the best treatments are hydrofacials and skin boosters.
When we talk about injectables, the two big names that come up are Botox and fillers. Can you please break down the fundamental difference for our listeners?
A very good question again, Dr. Ikra. Basically, people don't know the exact difference between Botox and filler, and whenever we see any actor or actresses on the social media, people would always comment that they have gotten fillers done or they have gotten some plastic surgery done. So basically, Botox is meant for those patients, or we use it in condition where we want to relax the muscle. So Botox is basically a protein, or we can call it as a neuromodulator. So what this neuromodulator do? It help to relax those tightened muscles. For example, if you inject it on the forehead lines or in the crow's feet or in your jawline, it will help to smooth out all the lines and wrinkles on your face. And what is fillers? Fillers are basically synthetic hyaluronic acid, and this hyaluronic acid is normally present in our body. It's inside your skin. But when you have dips in your skin, like you have these nasolabial folds, if you have under eye folds, under eye darkness or dip under eye area, so we can add fillers on those area. So fillers is like a cushion inside your skin, and Botox is like ironing on your skin. It is going to smooth out all the lines and wrinkles on your face. So that's the basic difference, and I've tried to make it as simple as possible for my patients and for the people who are watching us.
Ma'am, speaking of a filler, one of the most popular requests be for lips and cheeks. What's the key to natural looking results that still makes an impact?
Well, Rahil, I always emphasize on natural and subtle results, because the new era in aesthetic medicine is to look good in your natural features, and you should not look somebody else. So whenever we work on any patient's skin, first we always take their before and afters. We sit down with the patient and we talk about their what they have in their mind. So first we clear all their concepts, and then we talk about the results. So if somebody comes to me saying that, Dr. Sakina, I want a very good sharp jawline, but they don't have any jawbone at all. So for those patients, what I will do, I will use some product to make new bone on the jawline, because without that she's not going to have the results she want to. And then second, and the most important thing, is to use less quantity of the product. If you go beyond like 10 or 15 mls in a single go, it will give you a very fake and plastic look. So why most of the practitioners nowadays are going for the lesser quantities of fillers and botox is to give you more natural and subtle results. And then it is always like we can add more in it if you want to, but whenever you're going to any practitioner, in the start you should go very slow, because your skin needs time to heal up. And especially talking about the fillers, you said that most of the patient must ask you, they most of the people come for the lip filler or the cheek filler. So these are those areas where whenever we add any product, it needs some time to fit in on those areas. Like if I add 5 ml for example on the lip area, it will on if I do it in the first go, it will look very odd, because there is not that much of space on the lip area. So what I normally do is I'll add just 0.5 ml or 1 ml of the product, and I will call my patient after 2 weeks or maybe after a month, so that the product which I have added already, it will settle in, it will make its space, and then you can add more in it. So that's the key, and this is all about artistic hands and artistic mind. So that's the point.
And what about more structural changes without surgery? We have heard about procedures like non surgical rhinoplasty because many people prefer not to undergo surgical procedures.
Yes.
Dr. Ikra, very right. Yes, and nowadays people fear surgeries a lot, and they should, I guess, fear it, because surgeries are like you have a lot of downtime in it. So, if we talk about the structural changes, we can do it on the jawline, we can make a new nose if you want to. For those patients, we use hyaluronic acid fillers. We can even use calcium hydroxyapatite. We can use polylactic acid. Here comes the biostimulators like PCL. So these are those products, when we inject it inside your skin, it can make the bone even. So if we talk about calcium hydroxyapatite, is one of those products. When we inject it in your jawline or in your temples or in your even in your cheek area, it will start making new collagen, and it will give you a look that you might have had some surgery done, but without going under the knife, without having the downtime of surgery, and even without having any too much of bruising. So you might just see a little bit of pokes here and there, and your skin would be little bit red or swollen for few days, and in the next 1 or 2 weeks you will be much more beautiful, and your skin would be more fresh. So yes, liquid rhinoplasties and the jawline fillers and those biostimulators which we use on the skin, they give you some instant result without any downtime, and I love doing these procedures.
Okay, ma'am, let's talk about pigmentation. The sun here is enthusiastic, to say the least. What are the best solution for uneven skin and sunspots?
Well, Rahil, saying enthusiastic is a very polite way to say that. For pigmentation, yes, and for the sunspot, we do, first of all, we go inside the body and we find out the exact causes and the reasons. We get their labs done, and if they have any deficiencies like iron deficiency, vitamin B deficiencies, B12 deficiency, we need to correct that. And then secondly, you said the sun is very enthusiastic, so the ultraviolet radiations are the main culprit to cause the sunspots or the age spots. And most of the time it's very difficult to make the patient understand, because the patient would come to me in their 40s and 50s and saying that, doctor, I got these brown spots, little tiny spots on my hands, on my face. And the culprit is actually was there since their childhood. They've been in the sun and they've been exposed with the sun, and they've been getting the ultraviolet radiation throughout their life. And when I say them that the sun is the reason, they would say, doctor, we stay all the time inside and we are never ever in the sun outside. So that's most of the time that's not possible. Everybody goes outside. So those damages which happened in your past and that happened in your even childhood, that's the reason that causes DNA damage in your skin. And then in later on your life, your skin is now that not that much equipped to deal with those insults that happen in your skin. So now your skin is unable to correct those damages, and now you will have those spots on your skin. You will start having pigmentation, and even you will have lines and wrinkles and all those changes in your skin texture and quality as well. So to deal with these issues, we always talk about making your skin happy, to make new collagen inside your skin. Then we have to go on to those treatments where we do injectables inside your skin. We can even use chemical peels. I'm not very fond of using lasers in Asian skins, but yes, we can go for the lasers as well, because the lasers can give you a good like very fresh skin and with lesser downtime. But whenever you get any treatment which involve heat in it, you have to be very very vigilant to use good sun protection, and you cannot go outside in the sun after getting these procedure done. You have to take good care of your skin afterwards as well. So by correcting your inside and by protecting yourself, and when we talk about protection from the sun, it's not only the chemical sun protection. People think that we have applied the sunblock and now we are 100% protected from the sun, and we can stay all the day in the sun and we can get the sunbathing done and we will not get any harm. It's not like that. Whenever you apply any sunblock on your face or in any part of your body, you will get somewhere around 40 or 50% of protection from the sun. Rest of the protection is done with the physical protection, like by wearing hats, or you can use umbrellas, you can use full sleeves, and you have to cover your hands and your feet. If you don't do it and you are in the sun all the time, you will again get tan and you will have those spots and the pigmentation. And another biggest myth, people think that if it is cloudy outside and there's no sun outside, we can go without sun protection and we can go without sunblock. So ultraviolet radiation is very much there. Ultraviolet radiation can filter from the clouds and then it will damage your skin. So protection, very very important. And whenever you have any such spots on your skin, you need to go to your dermatologist as early as possible so that we can stop it right over there, rather than when it is on the full bloom. And now if we try to treat it, then you have to get through a lot of treatments and a lot of sessions of injectables. So at times it becomes difficult for the patient. So you need to understand these things.
And ma'am, what about someone who feels their skin isn't as tight as it used to be and they're not ready for a surgical facelift?
Well, Ikra, I guess everybody is not ready for surgical facelift. Even if somebody asks me to go for surgeries, it will fear me a lot. So, yes, we do have treatments to do for these patients, and here comes the role of microneedling radiofrequency, and we can use even CO2 laser resurfacing to resurface your skin to make new good collagen inside your skin, and ultra or high intensity focused ultrasound like HIFU comes in the category. These are those procedures which can tighten your skin and it will give you a little bit of subtle lift. Definitely it's not that good as that of surgical facelift, but surgical facelift does have some other downtime and other things with it. So whenever somebody comes to me, doctor, I don't want to go under the knife and I want something which can give me an instant fix like a thing, then we can go for these procedure, especially when we talk about microneedling radiofrequency. So I think with the microneedling radiofrequency nowadays is the new FDA warning, and now a lot of doctors and dermatologists are talking about it. what's happening is that we all know this warning already, that if you go very deep with microneedling radiofrequency, if your setting of the machine is like you are going way beyond the subcutaneous fat, definitely it can give you atrophy and it can damage your skin more. So we all know that already because we've been trained properly. So the warning of the FDA is for those patients who go to the unlicensed or the people who are not trained in this field. If you go to somebody who don't know his machines or her machines very well, then you can end up with atrophy and more damaged skin. So microneedling radio frequency is all about man behind the gun, and if you know the correct parameters, you can get some really good results and amazing result with this one modality. And again, it is one of those treatments, it doesn't give you downtime, your skin will be instantly lifted. And at times we combine this microneedling radio frequency with treatments like exosomes and growth factors, and when we add these, it makes a very good cocktail. So yes, you can have the result within few weeks and within few days without having the downtime.
Thank you so much, Dr. Sakina, for sharing your incredible knowledge with us. It's been a masterclass.
The pleasure is all mine. And remember, the goal of aesthetic medicine is to be safe in your skin. You should always consult a qualified practitioner, a qualified dermatologist whenever you have any aesthetic or any concern regarding your skin. Thank you.
Thank you for all our viewers. Until next time, stay radiant.